everyone. My name is Sonia Grant, and I'm the Executive Director of WorkSource Cobb. With me today is our Director of Operations, Elisa Jackson, and we're going to talk about how we reopened our service center in the midst of a pandemic. Now, I will start with saying that reopening a one-stop during a pandemic is certainly no easy undertaking, and I can say this because one-stops and their systems were not originally designed to provide services utilizing a hybrid or a virtual service delivery model. And very much like the rest of the world, we were not prepared for the challenges that the pandemic laid to bear. However, we did recognize early on that we were an essential service provider and that we needed to design systems that continue to meet our customers' needs in spite of what was going on around us. The questions for us were, how do we do that and continue to keep our customers and our staff safe? We initially closed our service center doors to foot traffic back on March 18, 2020. And prior to closing, we took extensive time to plan. I cannot stress this enough. Planning, planning, planning. Planning is going to have a critical element to having your ability to successfully reopen. Unfortunately, when this started back in March 2020, there was no past precedent to follow, nor were there any best practices in place. Yes, we had an emergency policy, we had a disaster policy, we had some procedures in place. However, they did not address how to respond to an emergency pandemic. We were clearly in uncharted waters. And this meant for us that we had to develop not only a reopening plan, but we also had to develop an emergency pandemic plan. I really felt like one could not be launched without the other. And of course, there was elevated fear and anxiety. It was running rampant throughout the country as well as our state, and even within my own organization. So first and foremost, we had to acknowledge and prioritize safety and the needs of our customers. The emergency plan addressed all of our organizational functions and it prioritized safety. And working with my management team, which included representation from all the departments, including our Equal Opportunity Officer and our Communications Manager, we scheduled reoccurring touch-base meetings along with my management team, including monthly staff meetings with our full staff. We developed very clear and consistent internal and external communications, and our plans included regular review of our state, local, and federal policies, in addition to people watching local and national news to ensure that we're able to respond quickly to any changes that might arise. Our organizational policies were adjusted and aligned with the new federal provisions of the CDC. In addition to that, we began to develop this hypersensitivity to the fear and the uncertainty that was existing. It was very important that we did not minimize the concerns and the fears that were existing. More importantly, we wanted to demonstrate our commitment and our care for our staff because these are our frontline workers, and without them, we knew that we could not support our community. The plan also addressed the shelter-in-place orders by providing all of our staff with safe passage letters, which included to law enforcement that they were employed by an organization that provided essential services, and they were therefore not in violations of the ordinance. And to further maximize safety, we also addressed public health and infection controls by establishing very robust office sanitation, as well as a 14-day quarantine for any staff that was traveling out of state. As an essential service provider, we knew that our existing service delivery model needed to change. So to do that, we operationalized all roles and responsibilities and developed a hybrid work model that consisted of both in-office as well as telework. We utilized a shared work calendar. The staff alternated days and hours to maximize their ability to social distance. And another critical component was assessing our staff needs and their own constraints. We had to be very flexible and nimble and sensitive to all the factors that compounded and often complicated their own ability to work and implement this smoothly. For example, we took in consideration the staff who had school-aged children, sick family members, or underlying health conditions, or maybe they were just concerned about their own safety. So we offered leave of absence as well as use of PTO. It was also important not to make assumptions about staff's ability or their own capacity or equipment needs, and ensure that we were not causing any undue hardship on them by asking them to utilize their own personal equipment when working from home. So initially, we provided all staff with laptops, remote desktop access, cell phones, and hotspots to support their ability to telework. We later moved that to Google Voice, which was a free telephone service that allowed staff to make calls from their laptops. And this began to help us to reduce some of the costs that we were incurring. We also provided all staff with personal protective equipment, including face masks and shields and gloves and hand sanitizer. And again, I cannot stress enough that ensuring that you're providing the staff with clear and consistent communication, as well as honesty and transparency throughout the emergency. We consistently reiterated to our staff the significant impact that the pandemic was having across the state and the country, and the very important role that workforce agencies played. And this meant that we never could really completely close our doors to customers, but instead we had to be innovative and change how those services were delivered. It was very important for staff to understand the why. Now that the staff needs have been assessed, we move forward with assessing our customers' needs to ensure that any policies or plans that we were putting in place did not have a disparate impact on their ability to effectively access and utilize the services. The redesign of our service delivery model included offering a full array of services, both in person as well as virtually. Virtual services included wheel orientation and enrollment with secure document upload that helped them to expedite their customer eligibility. In addition to that, customers were able to participate in virtual professional development workshops, career coaching, and a new online chat feature that allowed our staff to answer basic questions and schedule appointments online for customers who were in need of services in person. These changes, of course, did not come without a cost. There were some very serious budgetary implications that were related to not only our organizational needs, but to our customer needs as well as that we had to consider. The pandemic was not something that a workforce agency like ourselves or anyone had a plan for. So we quickly began to think about what other funding sources could we tap into to support our ability to meet these changing needs. As things persisted, the pandemic began to raise some of the most serious inequities in our country to its highest levels. The socioeconomic impacts of the pandemic was taking its toll on our customers, and it's taken its toll on their ability to access and participate in training. The digital divide was more apparent than ever. And unfortunately, that 75% virtual and that 25% hybrid model that we were utilizing was having a disparate impact on our customers' ability to access those services. Many of those customers lacked access to Wi-Fi, they lacked access to technology, or maybe they just didn't have the digital skills to use those virtual services effectively. And further exacerbating the issue was the fact that disproportionately low skilled workers and their minorities had been hit the hardest. And oftentimes, these are the very same customers who lack access to technology or lack those digital skills, along with having a multitude of other barriers. So we recognized very quickly that in person services were not only necessary, but they were imperative. Virtual services are an excellent addition to a service delivery model, but they cannot be the only way, the primary way that we're delivering services to our customers. And this is because we work with populations that have a spectrum of technology skills. So we as a workforce agencies have to ensure that we're able to service all customers, no matter where they fall on that technology scale. In addition to that, what we found out is that the federal and state policies were not easily aligned with providing services via a virtual model. For example, youth work experience. Like most organizations, we were extremely concerned with placing youth at in-person work sites during a pandemic. However, there was no reprieve from that 20% work expenditure obligation that we had. So we had to get creative and we began to identify remote work sites. In addition to that, we also worked with our regional partners and developed a youth summer career academy in collaboration with employers. And that career academy conducted employer industry panels to begin to demystify industries and provided online career exploration and skills building for our young people. As a side note, I will also say it was important for us to begin to take a deep dive into our WEO policies and the TEGLs that were associated with our programs. We needed to understand what we could do and what we couldn't do. We also work with our sister workforce agencies and other state workforce agencies to seek out best practices. And most importantly, we contacted state workforce leadership to begin to run ideas by them and seek additional guidance. After being close to foot traffic and using a virtual service delivery model and taking customers by appointment for only 3 months, we had a number of lessons learned. We decided to reopen utilizing a three-phased approach, which would help our customers and help our staff ease into our new normal and allow us to get used to the new policies and the past practices. We made safety our highest priority, and we took some of the most strict measures to ensure that we were able to mitigate the spread and keep our customers and our staff safe while not compromising access to services. To do that, we needed to execute some much more serious infrastructure changes. So I'm going to stop right here and turn this over to my Director of Operations, Elisa Jackson, and she's going to talk about that three-phased approach and all the infrastructure redesign that was necessary to support our safety of our staff as well as our customer. Elisa?
Hello, I'm Elisa Jackson. I'm the Director of Operations for WorkSource Cobb. As previously mentioned by Ms. Grant, we put protocols and processes in place to lessen staff concerns while safely serving customers. This made the infrastructure redesign of the One Stop our top priority. We began by installing sneeze guards, signage, increasing hand sanitization stations, and reducing seating throughout the service center in meeting rooms, the lobby area, and the break room. We encouraged customers to make appointments to regulate the number of individuals in the service center. We developed processes such as touchless document drop-off for staff work areas. Other processes included the hybrid work model and staff self-temperature check and sign-in. Communication was paramount. Therefore, the reopening plan was shared with all one-stop partners, the Workforce Development Board, and all staff. Staff meetings were held to initiate discussions, Q&A sessions, and provide training. As the pandemic intensified, obtaining PPE became a race for time as the demand increased for products. To make sure all safety aspects were addressed for staff and customers, we purchased disposable masks, personal thermometers, and reusable masks for staff. We purchased signage to encourage social distancing, wearing masks, and hand washing. We also purchased UV light wands for use to kill germs on frequently touched items such as papers, pens, and pencils. Additional hand sanitizer bottles were purchased and placed on all staff desks, customer computer stations, and in meeting rooms. Based on CDC guidelines, protocols were implemented to limit the number of people in the building per square footage. We developed a process to provide customer document drops without entering the building in the case of a large influx of customers. Shields were installed on the public computer workstations, and portions of the workstations were restricted to create appropriate social distancing. Lastly, cleaning protocols were elevated. The staff were tasked with sanitizing computer stations after each customer, wiping down writing instruments, and all work surfaces throughout the day. Now, this was in conjunction with us having a janitorial service that cleaned the building 5 nights a week. During the pandemic, WorkSource Cobb began operating under more stringent protocols. With phase 2 of the reopening, the center opened to the public with limited media output. We felt it necessary to limit publication of the reopening to allow staff time to orient themselves to the new process and be better prepared to serve customers. During this time, walk-in customers were accepted, but we maintained a limit of 10 individuals in the resource area and the lobby and the classrooms. We provided job seeker workshops virtually, and employer recruitment events were provided by appointment only. In an effort to enhance our service delivery, WorkSource Cobb added an online chat feature to our website. The goal was to create additional avenues to service customers, offering phone and virtual appointments as options as well. We took the opportunity to review and evaluate protocols for phases 1 and 2 for quality improvements to the plan. We assessed processes and determined if changes were needed or could be improved as we prepare for phase 3. Although the pandemic slowed customer visits to the service center, the increase in unemployed residents became the focus for workforce. The new normal focused on outreach to the community and pivoting to provide new service strategies targeting dislocated workers for high-demand industry training programs. Ongoing evaluation of protocols were conducted with staff monthly, and adjustments to service delivery were made as needed to mitigate risk and improve the organization's ability to meet customer needs. So that's the end of my presentation. I'm going to turn this back over to Ms. Grant to close out our presentation.
Thank you so much, Elisa. It's been almost a year since the pandemic emergency was declared, and I would say the sustainability and success lies in your ability to remain flexible and nimble enough to respond to the emergent needs of your customers and staff. Stay abreast of the changes in local and state policies and talk to your colleagues and identify best practices. Adjust your practices and policies as needed to keep everyone safe and improve service delivery. Always include staff in the development of the reopening plan. Be sure to encourage open and honest feedback. It may not always be what you want to hear, but it's certainly what you need to hear. Ensure that your environment is a space of transparency, honesty, and clarity about roles and responsibility. Again, it's important for people to understand the why. Remember that we're all working in some very uncertain times. Your staff and your customers and their families are all struggling. Take time to celebrate the little things. Host monthly staff meetings that are fun and engaging. And remember to always say thank you and acknowledge that you appreciate their commitment and their hard work. Remember, they're our frontline workers. Sustainability and success is rooted in following the guidance. Be willing to make tough and bold decisions and keep people as the categorical imperative. Thank you.